Morning, everyone. First, I want to thank Heather for being here to provide service for our hearing impaired and to assure that our community, everyone in our community, can hear the messages we share. I'm Terry Allen. I'm the Health Commissioner here at the Cuyahoga County Board of Health, and I'm here accompanied by my right hand, Dr. Heidi Gullett, who is our Medical Director here at the Board. So today we have a briefing for you on a number of important points. The Cuyahoga County has established a coronavirus helpline with the generous support of United Way 211 First Call for Help. I want to thank United Way for their incredible support of community service, Augie Napoli, their leader, in stepping in to assist the community in the way they always have in this emergency response. There is a new coronavirus Cuyahoga County helpline. The number is 1-855-711-3035. I'll repeat that number. The Cuyahoga County Coronavirus Helpline is 1-855-711-3035. Callers who need general information will be directed to the CDC and the Ohio Department of Health websites. Callers who require detailed information will hear a series of options before being connected to a live 211 operator. We encourage people to listen to the options to assure that you get the right information from the right place. We're grateful, again, to United Way for their partnership. What they do for the community every day often goes unnoticed, not unlike public health. And so we want you to appreciate their work and their community spirit of collaboration. To reach the, the U.S. Surgeon General said recently that social distancing is not social disengagement. So I think that's an important point. Dr. Adams, Jerome Adams, social distancing is not social disengagement. So that means now more than ever, the community spirit that Clevelanders show, how we take care of our own, we need to bring that forward and make sure that we're available for our seniors who are in their homes, staying safe. We need to be available for them to provide supports, checking on our relatives. As trusted neighbors, we have a responsibility to take care of folks in our community. Identify their needs. Do they need you to pick up some medication? Do they need you to run to the grocery store? Be there to support them and identify their needs. This is the time for us to pull together. For businesses, remind you that both the CDC and the governor's office are recommending that meetings and gatherings involving more than 50 people should be postponed or canceled for the next 8 weeks. As we talk about flattening the curve, reducing the potential for transmission by limiting the places where people can mix together, where people are interacting in close contact for extended periods of time, is the way to flatten the curve to reduce the number of fatalities and cases in this community, and that is our imperative. So these temporary restrictions are critical that we follow these, and we ask businesses to cooperate, and we know that they have been looking for opportunities to have remote work or telework options, and that's pretty critical. Many members of our staff who are supporting functions other than COVID-19 will be working from home as well, because we have to practice what we preach so that we can reduce the number of people present in our building each day and use social distancing to support the effort. County Executive Armin Budish also announced yesterday that county buildings will be closed to the public until further notice beginning today. His plan also includes having groups of employees work from home in order to reduce potential transmission. Again, this is an effort to show community-wide that everyone is stepping up to do their part. The county will still provide critical services which are listed on the Cuyahoga County website at cuyahogacounty.us. From the food inspection standpoint, our sanitarians are continuing to inspect our food service operations as usual. We know that there are no patrons at sit-down locations and restaurants. It's all carry-out or delivery, but we continue to assure food safety as we do on a routine basis throughout our community. Exceptions at this time could be locations such as hospitals and nursing homes where they're trying to keep visitors away in order to protect their patients and staff. Otherwise, we're working to assure that our operators who are affected by the governor's order are ready to make the transition from sit-down service to all carry-out. remind you that there are no special cooking considerations for killing coronavirus. The guidance around proper temperature control, reduction of cross-contamination of food within the food service environment and the food prep environment, the standard guidelines and education that are given to people that prepare food apply to coronavirus as they do for protecting against all pathogens. Wash your hands thoroughly, as we've said. The data shows 20 seconds of washing hands can reduce that viral load. It works. Wash your hands. Do what your grandmother always told you to do. Follow accepted cooking temperatures as found on the USDA website or on our website at CCBH. If you're preparing food for a neighbor, you're preparing food for your family, follow the guidelines on temperature control. Use a home thermometer and treat your kitchen as if it's a restaurant if you're providing food for a neighbor and just doing a friendly gesture to people next door. At the grocery stores are vital community resources, and they're committed to stay open and serve the community. Grocery stores are committed to stay open and continue to serve the community. We appreciate all the people working hard every day to keep up with the demand, and they've been very supportive. The chains have said, we're here to serve the community. And for the good of everyone working and shopping, please do your best to exercise patience and proper hygiene in the store. If you're sick, if you're coughing and sneezing, have somebody go to the store for you. Have somebody to go to the store for you. It's important that we step in and recognize these risk factors and be part of the solution. Take advantage of online ordering and home delivery if your local store offers it. Remember to maintain social distancing as you wait in line. We're talking about 6 feet. Let the person in front of you finish their transaction before moving forward. Also, as you wait to pay, don't stand directly across from the cashier if possible. Move to the end and wait to make your payment. Let's go back through the standard operating procedures of hygiene for us in this environment. Reminders again. Grandma and Mom told us. Cover your cough and sneezes in the bend of your elbow with a tissue. Please be sure that your tissues end up in a trash can. For those emptying the trash cans, be sure to wear gloves or wash your hands immediately afterward. Clean commonly touched surfaces on a regular basis. Things like door handles, things like computer terminals, keyboards, your smartphone. Don't share food, drink, knives, forks, spoons, or cups. This is standard protection against disease transmission. And maintain that social distancing, that 6-foot difference to protect you and protect others. I recently was on a call with Senator Sherrod Brown, and he told us, I think, an important story that we should take to heart as Clevelanders, as citizens, as one community. And that's that he described that she said to him, Senator Brown's daughter said, Dad, we shouldn't be thinking someone else has it and might give it to us. We should be thinking that I have it and I don't want to give it to someone else. So we'll mention that again. We shouldn't be thinking that someone else is going to give it to us. We should be thinking that we have it and we don't want to transmit it to someone else. I think that's a critical point. It means that we all have a responsibility, and it also speaks to this issue around stigma. We need to recognize that the coronavirus and viruses do not discriminate, and we need to remember that and not be treating people poorly or targeting people because we think they're specifically at risk. I think we need to be good citizens and support our community and, again, be part of the solution. So with that, I'm going to transition to Dr. Gullett, who will be talking about our current case information and other related details in that regard. Dr. Gullett?
I'd like to just pick up where Terry left off and also remind viewers that there is an army of community residents that are out working on the front lines, and I just want people to keep in mind that we have a lot of media people here who are working to make sure you have the most accurate information, but we also have an army of first responders, of public health professionals continuing to do their job, food safety inspection, out in the field fighting this pandemic, as well as an army of healthcare employees in this community who are showing up to work every day, and they are exhausted, they're tired, but they are doing this because they care about the community. And so I don't want that to be lost among us talking about all the things we want to do to prevent this. We need to think about all the people who are working really hard day after day, including the people in this room, to really make this flatten the curve a reality and get us out of this as quickly as possible and minimize the impact of people in our community. I also want to say that before I give you the case numbers, every single person represented in these case numbers is a critical, important member of our community. They are people. They are not cases first, they are people first. And so I want us to never forget the humanity in this situation. We have all been touched by COVID-19, but we also have people in our community who have this infection. And so I want people to continue to respect their privacy and make sure that you respect their need for space at this time. And we'll continue to give you aggregate updates, but we cannot provide any specific information about any individual patients. At this time, we have 26 cases in Cuyahoga County jurisdiction that is exclusive of the City of Cleveland, as their cases are counted separately. The age range for these cases is 14 to 86. The date of illness onset is February 29th to March 15th, and we have 2 of those 26 cases currently hospitalized. We have had 0 deaths from COVID-19 in our community. I also want to take just a minute to talk a little bit about testing. There's a lot of information out in the public and the media about testing, but I'm going to specifically talk this morning about exactly what a test looks like so that people understand. COVID-19 testing is one sample that occurs via a swab that goes fairly deep into the nose. It's a relatively unpleasant swab, and it does cause people most of the time to cough. Because of that, it's very important for healthcare providers who are testing patients who need to be tested for this infection to have on the appropriate personal protective equipment. That includes something to protect their eyes, to protect their nose and their mouth, as well as masks, as well as a gown and gloves. The test, once it is obtained, is then sent to a lab. And most of the time it is checked for influenza, as well as other viruses first. And if those are positive, then it does not move on to COVID testing. If those are negative, then the COVID test will be done in the lab. We have multiple places where lab testing is happening currently. And so those labs also have to have the right chemicals to run the test, and they also have to have the right vials to run the test. So the reason I'm explaining all of these pieces in detail is that I want the public to understand that it's not as simple as just walking into a lab or driving through a drive-through and getting a swab and it comes back in a very short period of time. There's actually quite a bit that goes along with it. And there are quite a few pieces that have to be in place to protect the healthcare providers from the point of taking a sample all the way to the point of the lab running the result and reporting it. It's also important to understand that we are prioritizing the highest risk patients for testing at this time. This is not a situation where everyone in the community should be what we call screened for this. We are not in that situation. Right now, the highest risk people need to be tested, and those are people who are sick in the hospital. And there, in some cases, people who are not in the hospital may need to be tested, but at this time, we want the public to understand the importance of testing those at most risk for serious complications from this infection. We are working with our hospital partners to understand the full scope of testing capacity in the community, and we will continue to communicate that to you as we understand it, as this is changing on a regular basis. But we want folks to understand exactly what testing is and who needs to be tested, and then we'll continue to talk to you about what our colleagues at the Ohio Department of Health are telling us about testing priorities as well. So this is both something that is important in our local community, but we also have to think about our state partners and work together with them so that we're sending the right messages about the full testing strategy for our state and our local community. Finally, I just want to end by reminding you what I reminded you on Monday. This is a stressful time for all of us. There's a lot of fear. There's a lot of uncertainty. These are really unprecedented times. But we are in this together, and you have a lot of people in this community who care about getting through this and flattening the curve as quickly as possible. And we are not going to stop until everyone in this community has what they need and they're safely at home. or we are back to business as usual. We don't know when that'll be, but until that time, please know that your health department, public health colleagues, your hospital colleagues, and other sectors are working very hard to make sure we do everything we can. But we need the public to listen to our messaging, and so please do everything you can as an individual to reduce the spread, including staying home, particularly if you are sick. And finally, please do something kind. I keep talking about that, but when we're stressed, we sometimes go back to things that we know, which is our stress response, and we may not lead with gratitude because it might be forgotten. And in this moment, please do not do that. We are beginning our days here at the Board of Health with discussions about self-care and caring for one another and gratitude, and that's how we end our days here. And so I hope people will take that with them as well, because in this time of stress and fear, we are together. So we'll take some questions.
Right. I want to say one more thing. That was wonderful, Heidi. Thank you very much, Dr. Gullett, for that heartfelt statement. Two things. One is that I want to thank my staff. I've been here for 30 years at the health department, and this is a remarkable group of people. All through this community, people have stepped up, but I want to talk about our folks. Round the clock, tireless support for this effort, committed to help this community, recognize this is why they got into public health. I want to thank all of them. Some of them are here, many of them are hard at work, and they're in the community delivering for you. They're part of this community, and they're committed to see this thing through. And I think it's a pretty amazing feat that you're seeing before your eyes. Stepping up and saying, we are here, public health safety forces are here to assist this community. And know that they're there to serve you, and they take it personally to their core. Secondly, we all have recognized, and we're watching unfold right in front of our eyes, that Governor DeWine and Director of Health, Dr. Amy Acton, are leading. They are leading. And in that regard, we should follow, because they have our best interest at heart. They are looking for ways to prevent interactions through efforts at the state level that we then take to heart and employ locally to prevent people from interacting and potentially spreading it to the most at-risk folks. Remember, we're protecting our seniors. These are people's lives in the balance. So we need to follow these rules and be part of that public health workforce, part of that response network. And lastly, I'll say, people have talked about how it's been quieter around. There's been silence they've noticed in places. That is the sound of prevention. That silence you're hearing is the sound of prevention. So let's recognize that as a public health intervention, as a way to reduce the spread of this virus. We can do this as a community. We're committed. And let's take this opportunity to really have an all-hands-on-deck approach and really address this problem as long as it takes to do it. And as we go forward over time, there'll be some challenges, and there's a system in place that's being developed to step in and assist those who are under-resourced and vulnerable in this community. And that is what I love about Cleveland. People will step up and they'll help each other. So with that, we'd like to take any questions that you may have.
Terry, I have a question. You talked about, the direction to businesses who still have people working.
Mm-hmm.
I went through a drive-through restaurant yesterday, and I was really concerned about the people at the window because they didn't have any masks, they didn't have any gloves. Is there any direction from the county to those employers who need to keep their folks out there working in terms of
Sure.
getting them some protective gear?
So first of all, I'll handle part of this from a.
Repeat the question.
Oh, yes, I'm sorry. Thank you for reminding me. The question in my office is what about the food service workers who are out there working and at the windows serving us as we go to pick up our food or deliver our food? And what about their safety and health? I think that's a great question. So I think, first of all, if people are doing any, by the way, the restaurants, patronize the restaurants. Go in and get your carry-out orders. Have food delivered, because they are a critical resources in the community. So we encourage you to do that. If you are doing food handling in the food service environment, there are guidelines that relate back to gloving, et cetera, based on the type of activities that you do in the environment. If you are at a window interacting with people, I think right now there are no recommendations on healthy people wearing masks. We know that that generally applies. There are no recommendations that healthy people should be wearing masks, okay? I think that the guidelines apply any time of year for a food service worker who may be ill. If a food service worker happens to be ill, they should not be in the work environment delivering services. That's a guideline that applies generally to prevent any spread of foodborne illness or otherwise. So that guideline applies to food protection as much as it applies to any other business. So we appreciate these folks on the front line. They're part of the critical infrastructure. So show your appreciation when you drive up and thank them for being there to serve. If they're ill, then they should be at home, and our food service operation workers, all of our public health sanitarians are out every day, all day, as we are in normal times, inspecting restaurants, checking in, following up on concerns and complaints that may emerge, and addressing them, assuring that we're maintaining food safety now, as we always have. So I think that's the mode that we're in, and that will continue as business as usual in that regard.
So just to be clear, there really is no guidance for people who are doing that kind of work to the business owners for what those.
Right now, if people are ill, they should be restricted from work, and that guidance has stood, so it's not, I think that guidance has always been in place. And the guidance is that if you're a healthy person, there is no need to wear masks. It's taking masks away from other people in the clinical environment and EMS that need masks to take care of sick people.
What plans are being made to get people tested, especially people who may not have a primary care physician, may not have access to transportation?
The question is, what are the plans to get people tested who particularly may not have a primary care provider or may not have transportation? So what I want to go back to are the priorities for who needs to be tested at this time. The highest risk folks for having complications from this infection should be the ones who are prioritized for testing. Those are patients who are sick enough to be in the emergency department or in the hospital. We know that ambulatory testing is happening, but that is not the highest priority right now. If people are sick and they think they have symptoms of this, but they're not severely sick, we encourage them to call their healthcare provider to talk about their symptoms to make sure there isn't a complication developing, but to do that from home and to stay put at home. Self-isolation is critically important right now, and if you have a mild infection or mild symptoms and you're stable at home, getting a COVID-19 test is not going to change your management. You're still going to be staying at home, and you're still going to be drinking a lot of fluids and taking supportive medications like Tylenol and ibuprofen. There is not a recommendation currently for us to be testing everyone in the community. We all want to know how widespread this is. We all want to understand, including our Ohio Department of Health colleagues, what sort of level of infection exists across the general community. But that is not the testing capacity that any of us have anywhere in the United States right now. Right now, we have targeted testing based on what we've received from the various labs, and we're prioritizing that for those folks. So we will come back to you with specific information about our community's testing capacity. If we change any of the guidelines about who should be tested, then we can tell you a little bit more about an ambulatory or outpatient testing strategy. But at this time, that is not our priority for testing.
You said people should call their caregiver.
Correct.
The reality is a lot of people in this area don't have caregivers. Who
Right.
should they call?
So the question is, a lot of people in this community don't have caregivers, so who should they call? So first of all, my first message is, I am both a public health doctor, but I'm also a family physician, and I have a clinical practice in this community. And this is a great time for everyone to identify your own personal primary care provider, because these are the people who are going to be taking care of you long into the future. So that's the first message. Please get a primary care provider. They are answering their phones. They have added people to help them answer their phones. And they have added telehealth capacity. So multiple organizations that provide primary care in this community have ramped up telehealth capacity literally overnight. There have been procedural and policy changes that have allowed us to get telehealth set up that we didn't have 3 days ago. And that's a really good thing for our community in the long term and the short term. So you can call Metro Health even if you don't have insurance. They have a line. It's 440-59-COVID. That's the same line I gave you on Monday, 440-59-COVID, and there is telehealth available that way, should you not have a primary care provider or not have insurance. But if you do have a primary care provider, I would strongly encourage you to call, don't go in, call, and see what telehealth options they have available. I know my practice, my clinical practice, is getting this going today in very short notice, and we're trying to get our patients to understand we now have a new way to take care of you that doesn't require you to come in our office and sit and maybe get exposed or expose someone else. So we do have new capacity, but we're still ramping up. So there'll be some, over the next week, I think, some changes in how much capacity we have for telehealth. I do know there have been reports of delays on some of those telehealth visits that people have had, but as new providers come online, those will go quicker and quicker.
And are you guys still managing the close contact people had, like the people, the 26 people? Are you still managing who kind of they came in contact with and communicating with them?
Let me take that.
Yes, please.
The question is, are we still managing the contacts of the 26 cases we currently have? Yes, we are. So the way that our operations work here, and this is the way that local health departments work across the state of Ohio and across the country, is that we are notified of cases through two routes, through the Ohio Disease Reporting System, which is where the labs report, and we are also notified through providers who order the report. Then they give us a report out when cases return positive. So when we find those cases out every morning, we have an army of disease investigators here that include epidemiologists as well as public health physicians, and we are calling every single one of those cases, we're interviewing them, and then we're learning about their contacts. Once we get their contacts, our army then deploys on calling every single one of those contacts. So this is a critical strategy to flattening the curve. So you heard me talk on Monday and you heard Terry talk today about individual strategies to flatten the curve, staying home, washing your hands, wiping down surfaces, things like that. You heard us talk about organizational strategies to flatten the curve. Get your employees working remotely. Try to minimize the number of people in a certain space. Maintain social distancing when you're in a physical space with your employees. The other thing is the community interventions, those shutting down places where transmission can occur, closing down gatherings, et cetera, things like that. And then the public health strategies, those public health interventions, and that's contact tracing and talking to cases and making sure that they have what they need personally and that their contacts understand what we're concerned about and when to contact us. We have a 24/7 line that is simply for contacts to contact us, and they do get a physician 24/7 to talk about their symptoms if they're worried. They contacts don't have symptoms at the beginning and get that, they're given that number, and that number is also available for physicians to call in to report new cases to us. So we have set that up independent of our 24/7 infectious disease line that we run 365 days a year for other infectious diseases.
Will your operators at the new health line that Terry talked about, will they be able to direct folks to some place they could call and get telehealth, or if, like as the gentleman said, if they don't have insurance or if they don't have a doctor?
So the question is the new telehealth line with 211, will that direct people to resources to do telehealth if they don't have it? So we worked for the last 2 days on a script that would, and I would give a shout out to our colleague Rick over here who worked really tirelessly with his staff and the 211 staff to get the script right. We'll continue to edit it, but it has a lot of branching options so that callers get exactly what they need. And the 211, those are not clinical providers. They're not going to be triaging calls for clinical complaints. They're going to get you to a clinical provider. They're going to link you in the right direction for a clinical provider.
Yeah, I want to follow up. Thank you, Dr. Gullett. The other piece on that is we'd encourage people to be patient. Be patient and listen to the message. If you hear an option, to press 1 or press 2 to go somewhere and it's not your first option, be patient and listen to the message so that you can choose the right option so you receive the service that you're looking for. I think that's important. The other thing I thought is important to mention is Dr. Gullett talked about the fact that we have an entire community that has come together to respond in different ways. At the Emergency Operations Center, the City-County Joint Emergency Operations Center, they're identifying needs that are emerging. They're helping with messaging. They're pushing it out to sectors all over the community. And that is a critical function, and they're working hard at the Emergency Operations Center. It assures continuity and unified messaging, which is critical in every emergency. My experience with H1N1 in 2009, my experience with Ebola, that a joint Emergency Operations Center together with the city and county works. It helps to help to calm concerns because the message is consistent. So I think that's important. The other thing is, as we move through this process of people staying home, staying out of groups, over time, there's going to be concerns that emerge from these fragile citizens and our under-resourced communities. I saw today a story about the food bank looking for donations. It's time for people to give back. It's time for people to talk to social service agencies as needs arise. And we know that our philanthropic community is also very supportive in these times. We're fortunate in Greater Cleveland to have a very engaged and committed philanthropic community to make sure that if people need help, that they are there to step in this moment. And we can see the best of all of us, the best of humanity in these moments. So reach out and help that social service provider. Find out how you can be part of the solution as we move through the coming weeks, because there will be challenges that emerge. We need to be clear about that. They will happen. But we'll watch the dials here going forward on how new cases emerge, and we're going to prevent them. You are part of the public health workforce when you stay home, when you protect that senior who's a relative of yours or the neighbor, and you look out for them, and you're not interacting with them to potentially and unknowingly perhaps spread the virus.
Based on your conversations with healthcare providers, do you believe there is enough testing capacity in Cuyahoga County, even for high-risk patients?
At this particular time, we've had quite a few patients tested. The question was, is there enough testing capacity locally? So I think it's important to understand the reasons we test. In this case, there is no treatment. So a lot of times we'll do a test for an infection so that we can provide someone with the right treatment. If someone has influenza, I have Tamiflu, I can give you that if I know you have it. In this particular case, there's no treatment for COVID-19. So we're not doing a test to identify how I can treat you better. When people are really sick and hospitalized, we are doing a test to determine, is this influenza, is this a different virus, or is this COVID-19? Because they may need supportive measures, they have the potential to become sicker quicker. Those are the reasons that we would test somebody who's very sick. The reasons we would test someone who's not sick are that we want to understand how widespread this is in our community and how many more interventions we need to implement to flatten the curve. And we know that in the United States, it is no secret that this country has not had the full testing capacity that would have been ideal from the beginning of this pandemic. We see our federal government trying to get testing out to local communities as quickly as possible. So as a physician, I would love to have more testing capacity so I could understand what kind of spread we actually have, but that's not going to change how we manage people. It's not going to change any treatment that we're giving people right now in their homes. So we're doing the best we can with what we have, and we're continually trying to coordinate with the hospitals to understand what that testing capacity is so that we can target our testing to the right folks. If we get a bunch more testing, you'll hear me up here talking to you differently about who else should be screened and how we can do that safely. But right now, we've got to go with what we have, and it doesn't help me to spend any time being frustrated about our testing capacity. I need to focus my efforts on understanding what it is, deploying resources appropriately, and advocating for the resources we may need as this unfolds in the coming weeks.
Do you believe you have that resources now?
To understand the scope of community spread here, I don't believe we do, but I believe we have testing for hospitalized patients. And the problem is if we use all that we have right now on testing for people in the community who are mildly sick, we won't have testing for the people in the hospital who it actually might change their management a little bit. So we're going to continue to update you. We're hoping that we are able to speak with a wide range of our community hospital partners today to get even a better sense. I will tell you, this is changing by the hour. I'm on calls all day long for the last 3 days talking about how many people have been in drive-thrus and how many people have been tested in hospitals and how much capacity there is at our private labs, our hospital labs, our state lab. So what I tell you right now is going to be different than in 3 and 4 hours as far as what testing is available. But my job here is to make sure that we're coordinating among everyone and that we have a community-wide testing approach that we all buy into and that serves to flatten the curve for all of us together. So I will continue to update you as I have additional information about that.
That's a flu.
So you guys expect more testing sites to come online today?
I would not say that. I'm not prioritizing ambulatory testing. I personally think we need to be prioritizing those sickest folks in the hospital, and that's why it's important for us to coordinate. I will tell you, there's a large amount of influenza A in our community right now. We know that somewhere in the neighborhood of 20 to 27% of some of them, those are rough numbers, we don't have the final numbers, but over the first few days of drive-through testing, you heard me talk earlier that people actually get an influenza test first. About 20 to 27% of those first wave of tests were positive for influenza A. So we have not just an issue with COVID-19 in our community, we have an issue with influenza in our community. And if you've seen our weekly influenza reports, you know that we've had many deaths in this community from influenza this season, and that's critically important. So people need to understand that we also need to be cognizant of the fact that it could be influenza that you have if you have a fever, and if you're mildly sick, staying home with influenza is also a really good idea.